Good morning and welcome to Access Health. Today we're exploring ways you can improve your body's mechanics with the latest innovations in medical care. Also on the show, how the ketogenic lifestyle can keep your body running at peak performance. Access Health starts now. Ketogenic diets have been used therapeutically for the treatment of epilepsy since the 1920s. Today, armed with even more scientific evidence, many practitioners have continued using ketogenic diets as nutritional therapies for obesity, neurological disorders, and even some cancers.
What got me really excited over the last couple of years was using this powerful metabolic therapy for an expanding range of applications, including neurological diseases, cancer, and performance applications.
Many people are also choosing to live ketogenic lifestyles based on the science of the potential benefits for health, performance, and possibly even fat loss. Joining us today to help us understand more about the power of ketones is Dr. Andy Campitelli. Welcome, Dr. Andy.
Thanks for having me.
Thank you so much for being here today. Let's jump right in. What exactly are ketones and how do they work within our body?
We have three macronutrients. We have carbohydrates, which are really great for an instant source of fuel in the body. We have protein, which helps build muscle. And then we have fats. When our body breaks down fats in our liver, it creates these little molecules called ketone bodies, which then move into our blood and circulate through the body to whichever organ system needs them as a source of fuel. We only do that when there's a lack of glucose or sugar in our system.
What does eating a ketogenic diet look like?
Right, it's very different from the standard American diet. We're so used to really high sugar foods, foods that spike our blood sugar, spike our insulin, and so we get energy rises and crashes that go along with that. With the ketogenic diet, it's actually a very high fat diet, so at least 70% of your diet comes from high healthy fats, moderate protein, and very low carbohydrates, so less than 10% of your diet or under about 50 grams of carbs per day. So quite a shift from what most people are used to consuming. Everyone is so used to low fat, no fat, so it's really getting that mind, so switching your mind in that mind frame to embrace the fats and really understand the benefits that fats have for you in your body, and that eating fat will not make you fat.
Well, I know that endurance athletes really love burning energy this way because they feel like it maximizes their performance. How so?
Exactly. So in the past, athletes were very sugar fueled, and you heard a lot about carb loading and things like that. But now we're seeing athletes are moving more towards that ketogenic state because it gives such a great source of fuel. Really great for the brain, for mood, for concentration, but also helps a lot with endurance. So, and also the research is showing from a muscle standpoint, it helps to build and maintain muscle mass. So there's a lot of benefit for athletes.
Are there any other benefits aside from, maximizing their energy supply?
Absolutely. So because the diet is moving to a lower carbohydrate, higher fat diet, the first thing we see are changes in blood glucose levels and insulin levels. So we're going to see the insulin levels go down. We're seeing improvements in insulin sensitivity, changes in metabolic syndrome markers like cholesterol, so improvements in HDL cholesterol and LDL, even changes in blood sugar levels. We also know that ketones can impact our hunger hormones, our leptin and ghrelin, so we're seeing changes in food cravings, our sense of satiety or desire to eat, so a lot of really great benefits.
It sounds like a ketogenic lifestyle can be difficult for some. So do you have anything that will increase the level of ketones in your body?
Absolutely, and you're right, it can be quite difficult for some people to follow the strict guidelines of a ketogenic diet, and in the past that was really the only way to get ketones into our system or into our blood. But recently in the past few years, we now have exogenous ketones. So we have Keto OS by Pruvit as an exogenous ketone supplement where you can actually drink the ketones, allowing your blood levels of ketones to increase, so it puts you into a state of ketosis even if you're not following a ketogenic diet. And if you do follow a ketogenic diet, it really does help to support that transition in the body as well.
Well, we're going to actually be meeting in just a little bit with Brian Underwood, who is the CEO of Pruvit, who's got lots to say about these type of ketones. So stay with us and we'll be right back. Welcome back to Access Health. We're here with Dr. Andy Campitelli, and we've just welcomed Brian Underwood, CEO of Pruvit. Welcome, Brian. So tell me a little bit about Pruvit and how you've managed to bring ketones to the market.
When we started Pruvit, the focus was how can we introduce evidence-based products and programs to help people become a better version of themselves. And that's when we found the technology of ketones and some of the research that Dr. Dominique D'Agostino was doing. Our product is actually utilizes a patent that he patented through some of his research through ketones and ketogenic diet at the University of South Florida.
Tell me a little bit about what we have here today.
Well, you know, our products were inspired and formulated to just help support the keto lifestyle or for anyone that's looking for a greater fuel source.
So it's really simple to take. We wanted to make it convenient. So you have little packets that you can take with you during the day. I generally suggest taking it first thing in the morning to start your day. If you're new and you've never had them before, start with 1 serving in the morning. We also have a keto cream that you can start with, so take it in the morning, see how you feel, but generally I like to do it twice a day. So first thing in the morning when you wake up, and then in the afternoon when you feel that energy dip kind of around 3 o'clock.
Brian, where can we find more information about ketogenics and about your products?
Check out, you know, our Facebook page, facebook.com/justpruvit, J-U-S-T, Pruvit, or our website, pruvitnow.com. And we have a wealth of information, and we have tens of millions of experiences out there, so you can actually hear some of the stories and some of the impact that the technology is making in the market.
Fantastic. Dr. Andy and Brian, thank you so much for joining us. And of course, you can find everything you've seen here today on our website, accesshealth.tv. And don't forget to follow us on Facebook and Twitter. More and more people of all ages are turning to biking, walking, running, and working out in the gym in an effort to live healthier, longer lives. As a result, we now have this large population with a lot of wear and tear on their bodies who are finding it necessary to have joint replacement surgeries earlier in life. Access Health caught up with hip and knee specialist Dr. Jimmy Chow to learn about one of the latest surgical approaches helping put the skip back in our step.
My name's Chris Appleton. I'm 42 years old, and my hip actually started hurting about 2.5 years ago. Went to college at Pittsburgh State, played college football, won a national championship, probably part of the reason why I needed new hips.
My name is Carol Alice. I'm 56 years old. Probably about 6 years ago, I noticed just a decrease in mobility. 2 years ago, it just progressively got worse. My walking was diminishing, my ability to get up and down off the floor, and then traveling for work really became more complicated.
We know that over the past decade, the need for joint replacement in the United States has more than doubled. And so we're treating younger patients earlier with arthritis in their hips so that they don't have to live the rest of their life with arthritis in their hips until they get, quote, old enough.
A lot of pain, discomfort, difficulty sleeping, could not stand for long periods of time, couldn't sit for long periods of time, couldn't walk. It was very uncomfortable, very debilitating.
Everyday things that I took for granted, people take for granted. Tying your shoes, putting on your socks, clipping your toenails, bending down and having to go to the bottom shelf at the grocery store, getting in and out of cars, climbing 2 steps. Even getting off a plane for me was one of the most horrible feelings in the world.
You think it's your sciatic nerve, you're getting older. It's that curve of 45 to 50 that we all get.
Originally diagnosed as lack of flexibility in my hip, and then it was diagnosed as a sciatic nerve problem.
You know, I tried the chiropractor, I tried physical therapy, I tried injections. They were all very short-lived. Oftentimes physical therapy, swimming, created more pain at the end of the day than it did actually relieving it. My primary care doctor did the x-ray, noticed that the x-ray had some deformity, and he referred me to Dr. Chow. And then Dr. Chow diagnosed that I needed a new hip.
So I had 0% cartilage in my left hip and 25 to 30% cartilage in my right hip. And my specialist recommended that at that point I start looking at surgical options. I definitely wanted to seek the best surgeon and try to understand the various procedures that are out there.
The first time that a patient gets offered a hip replacement, their answer is often, no, I'm not ready for that. It's kind of a hard pill to swallow. It is considered major orthopedic surgery. But once you get over that initial shock, and you start talking to other surgeons, and you start to get a consensus about what's going on around your hip, then it's much easier to digest in terms of that.
I'm only in my mid-50s, and still wanted to travel and do everything I had been doing. And so that's when I made my final decision to use Dr. Chow's new procedure.
Now, hip replacement surgery historically removes the ball of the hip. That's why it's called hip replacement. So the ball of the hip is what's diseased, and it becomes kind of flattened or misshapen, and it kind of grinds on the hip. And so we replace that ball, and we put a liner in the socket to protect the pelvis. One of the earliest ways to do hip surgery were all based on keeping the hip in kind of a straight position. And by flexing the hip into more of a fetal position, all of your muscles become relaxed. The main structures we cut are going to be skin, then fat. Our average was 6 and 8 centimeters. And then we split the muscle without cutting the muscle. So I actually use my finger to split it. We're actually using the normal spaces between muscles. And so we're actually placing retractors into positions in between the muscles. We expose the envelope of the hip. We make an inline incision, which is just a straight line, and open it up like that. And then that capsule becomes a reverse tent for our entire procedure. We're not ripping anything around. We're not putting stress on the hip that we can avoid. We're really trying to be very gentle with everything. SuperPath is a convertible surgery. It's a surgery that starts off as SuperPath, but you can easily convert it to the workhorse incision that you're used to. And worst case scenario, you don't get SuperPath, you get a traditional hip replacement. Contrary to traditional surgery where you cut everything and then it's going to take you about 3 months or 2 months to heal that part of it. We're not doing that. So what I tell my patients, and this is what I see as an average in my office, most of our patients are up and walking within hours of the surgery. But the nice thing about this is that it puts the healing process back into the hands of the patient because they're no longer sitting in bed in order to get them to heal enough that they can go put on their own clothes or shower themselves or make themselves a sandwich. They should be able to do that pretty much right away after the surgery.
Within 3 hours of being in my room, I was up and walking on my new hip.
The day after surgery, I walked a mile on both hips, and I was able to walk up and down steps the day after surgery.
Most of the problems that patients experience after a SuperPath hip replacement don't necessarily come from the surgery. They actually come from the immediate change in their activity level. So they go from basically not doing much to all of a sudden being able to do quite a bit, and they can move quite a bit better too. So we know that the hip replacement is going to work fine, but now what we want to do is we want to prepare that patient for their new onset activity level. And that's what almost all of the physical therapy is based on. It's quite exciting.
I have done workouts. I have done some light jogging, fast walking in the last 9 months. And I've done a lot of swimming this summer and absolutely pain-free.
It's been a godsend for me. The surgery enabled me to get back to a lifestyle that someone at 42 years old that really is healthy everywhere else should lead.
Happy walking.
It's pretty awesome. Nicely done.
You man. You man.
Access Health correspondent Amber Milt brings us the latest in a treatment alternative for obstructive sleep apnea and snoring. Take a look.
According to the National Institutes of Health, an estimated 12 to 18 million adults in the U.S. suffer from sleep apnea, and a whopping 37 million Americans suffer from snoring. The rest of us that are living with said snorers, well, apparently we're not getting the rest we need either. Thankfully, here with more information and the latest technology is Dr. Sadaifi, a board-certified oral and maxillofacial surgeon who's been in practice since 2003. Welcome, doctor.
Thanks for having me.
Okay, so right off the bat, what causes snoring?
The causes are with some sort of narrowing in the upper airway. Those narrowings could be due to nasal anatomy, such as deviated septum. It could be due to large tongue or mandibles, which is the lower jaw being set too far back, allergic related symptoms. It could be due to weight gain. Aging can have an effect on it as the soft tissue in the oral cavity becomes more floppy and loose. And also at the same time, the muscular tone decreases. The consequence of that would be some of the health manifestations of it as the snoring becomes more progressively significant and maybe develop into sleep apnea, which can lead to hypertension, potentially development of coronary artery disease, more risk of a heart attack, more risk of a brain stroke, or development of diabetes.
How do you even know if you're snoring?
It depends on how much the snoring is affecting your hygiene of your sleep throughout the course of your night. Some of the symptoms for more significant snoring could be daytime sleepiness. It could be having headaches in the morning when you wake up, finding out that you cannot concentrate the way you used to, lack of memory, or even in the more severe cases, people can have depression and mood swings.
All right, so if we think that we might have a sleep breathing disorder, how do we get diagnosed for that?
The first step is to see your doctor, and they are going to take a history. The relevance of the history is significant, and then they're going to do a physical exam. Your physical exam will be looking at your vital signs and other factors which can be affected by snoring as well, but beyond that, by looking at your anatomy of your facial skeleton, oral cavity, and your nose. They're going to look for some of the information that I mentioned earlier, and then they're going to refer you to have a sleep study done.
Okay, so now if we're diagnosed with sleep breathing disorders or sleep apnea, like all hope isn't lost, right? There's treatment options, but what are some of the goals of those treatments?
Well, the goal is to restore ventilation. That means restore breathing, allow the air to go into your lungs without too much resistance. The gold standard so far for, in this country for sleep apnea cases has been CPAP. The CPAP is a machine that has a mask associated with it. Essentially, it's a pump. You put the mask on your nose, on your mouth, and then with a strap behind your head that gives a positive airway pressure. But as you can imagine, it's not a comfortable device. The biggest challenge is compliance. More than 50% of the patients who would benefit from that device do not tolerate it. So that's the one modality. The next step would be considered now what becoming more popular, which is mandibular advancement device, which is the device we have here, is similar to that, but there are different types of mandibular advancement devices out there that you can consider. And finally, for severe cases, it becomes surgical options.
Now, you brought today what looks like the mouth guard type of treatment device.
That's right. So this is very similar to other type of mouth guards, and I am also a person who uses this.
Okay.
And part of the reason I became interested in it because it made an effective difference for me. I have been using mandibular advancement devices now for over 3 years. But what the challenge was, majority of these mandibular advancement devices depend on you still breathing through your nose. They bring your jaw forward, they bring your tongue forward, but they require you to have an open nostril. What's different with this unique patented technology by Ovantis is that this 3D titanium printed device allows generation of these delicate chambers which lets the air pass through your oral cavity and be directly delivered to the back of your nose. So even when you have your mouth closed and your jaw advanced, it still allows you to breathe to your mouth. So if your nose gets congested as a result of allergies or when we lay down, the air diverts to the front of this and it passes, so you really have a second nose. So this equilibrization that takes place between your nose and oral cavity gives you much decreased airway resistance.
And as a traveler, I mean, right off the bat, I'm realizing this is extremely portable. So how effective is this?
So Ovantis has done some really good clinical studies on here. They have found that 100% of the patients experience significant decrease in the amount of snoring that they do. And over 82% stop snoring. You want to reach out to your doctor, and because these are oral devices, many times it will be also your dentist who would have to be involved in this because they are the ones who make it. I would recommend, depending on where you live, you reach out to the website for Ovantis and find out who the providers are. They can tell you who actually has been trained to provide you with this device in your community.
And I've got to just say one thing, because I have to wear a mouth guard. These are custom designed to fit each person, so they're going to be comfortable, right?
They are. They are custom designed for each particular person, and then there are measurements that are done by your provider. That's why this is by prescription only. You cannot actually go out there and buy it on your own. Not everyone is a candidate. If someone has, there are some people with certain dental-related issues that may not be a candidate, or people who are missing teeth and have dentures, they cannot wear these. So your dentist can help you figure this out. But majority of the people are candidates for it.
Well, thank you so much, doctor. This O2 vent sounds like something that husbands and wives are probably going to be thanking you for.
It's going to help relationships stay together.
That's absolutely what we want. And if you want more information on the O2 vent, you can visit their website at oventismedical.com. And as always, you can access all of the important information we discussed today by going to our website, accesshealth.tv.